I'm Dr. Carolyn Lineber, and I'm a member of the Los Alamos Heart Council, who brings you these wonderful programs. And we work pretty hard to try and get speakers, and we're so delighted to have Jenny Mills talk with us tonight. Jenny has extensive knowledge in supplements, vitamins, how they interact, and also is very interested in palliative care and pain management. So she's a fountain of knowledge, and I hope you get a chance to ask her as many questions as you can. So Jenny, take it away.
Okay, can everybody hear me okay? Okay. Thank you all for coming out tonight. I really appreciate this attendance. This is great. So tonight I'm going to be talking a little bit about herb-drug interactions and how important this is. This has come up especially recently in the past 15 or 20 years where as healthcare providers we're seeing issues in our population that we're seeing with some of these interactions. Okay, so there's a few topics for discussion that I want to talk about. First, we'll review statistics regarding the usage of botanical remedies in the United States. We're going to talk about regulatory processes for these supplements. We're going to look at how they're produced and the variability that goes into that. We're also going to look at the physiological responses to phytochemicals. We'll discuss some important clinically relevant drug-supplement interactions. And we're going to talk about the importance of open dialogue between healthcare providers and our patients. So what are dietary supplements? They're defined as, distinct from drugs or food additives, and this is, quote, a product other than tobacco added to the total diet that contains at least one of the following: a vitamin, a mineral, herb or botanical, an amino acid, metabolite, extract, or a combination of any of those. Now, this is really surprising. There's around 30,000 dietary supplements sold in the United States, and they release about 1,000 new supplements every year. So there's just a huge amount of supplements, and it can be very confusing for both the healthcare provider and for the consumer. Okay, now here's a few statistics on usage. So about 15 million adults in 1997 took prescription medications concurrently with herbal remedies and or high-dose vitamins. So that's about 20% of all prescription users in the United States. And this also includes about 3 million adults who are 65 and older. And that's really important to us as healthcare providers because that population are our greatest consumers of conventional medications. And this might put them at a higher risk for herb-drug interactions. Now, less than 40% of all patients actually tell their healthcare provider that they're taking them. So this is also important to healthcare providers because a lot of consumers don't really consider herbal supplements as drugs, even though they do have active ingredients. And consumers are also less likely to link any herbal supplements to any adverse drug events or reactions. And also I came across a study in a cardiovascular clinic, and they found that about 64 of patients reported use of alternative therapies with their prescription medications, and half of those patients took supplements and they didn't really know that there might be a potential interaction. And especially with drugs like warfarin or amiodarone or sotalol or digoxin, which they were using in this clinic. And about $32 billion a year is spent on thousands of different dietary supplements, so it's a really big business. I kind of like this little joke because it says, it's an experimental drug. We're still testing to see how much consumers will pay for it, which is, I think, so true. So obviously I can't talk about the thousands of herbal supplements that are out there individually, so I'm going to focus on some of the top selling supplements in the United States. Ginkgo biloba, St. Johns Wort is a big one, ginseng, garlic, and a few others. Okay, now a lot of people don't really understand the regulation of herbal supplements, and I think this is really important both as consumers and as healthcare providers again. Manufacturers of these supplements are not required to prove any kind of efficacy or safety, which is a little bit scary, I think. They cannot make claims for treatment or a cure of a disease, but they can state the product's physiologic effects. So, you know, if it really doesn't work and they're saying that it works, or a lot of times we're finding they're actually saying that it might treat a disease, and they're not supposed to do that. However, like I said, with all of these thousands of supplements that are on the market, a lot of times they're not regulated for that statement, unfortunately. They do not have to document any testing or quality control. Unlike conventional medications, they document all of that with the FDA. And there's very little consumer information regarding the safety and any adverse effects that might happen with these. And the only thing they have to do as far as regulation in the United States is send a copy of the label to the FDA. That's all. So they send a copy of the label, and they can start marketing the next day. So that's why there's 1,000 new products every year. So that being said, since they don't have to prove safety or efficacy or how they make it or produce it, there's a lot of problems with safety. So active compounds may vary 200-fold between manufacturers and batches. So that means you can take, for instance, St. Johns Wort, and you can take 5 different products of St. Johns Wort, and you can test each product to see how much of the active ingredient is in it, and it will be a huge variation in the strength. And also between batches, that means you can take the same manufacturer and take 2 different bottles that were produced at 2 different times and find a big difference. So even though the bottle might say that it contains 200 milligrams of the active ingredient, it probably doesn't, or it has way more, or it doesn't have any at all. So big variations. There's also additives and contaminants that are commonly found. And they can be contaminated with things like caffeine, endomethacin, heavy metals like lead, mercury, and arsenic, and also fungus and bacteria, some of which are human pathogens. So it can be dangerous. In 2009 alone, the FDA identified herbal products that contain undeclared sibutramine, which is a weight loss supplement, fluoxetine, furosemide, bumetanide, and a bunch of other, and those are pharmaceutical drugs, so a lot of people take herbal supplements because they don't want to take the conventional drugs. However, they find that some of these herbal supplements contain active pharmaceuticals that way. There's also misidentification of plants, so we don't know if it's been identified as the correct species. Where was it grown? How was it grown? What time of the harvest was the harvest? And what method of processing are they using? How are they extracting those active ingredients? And this last point, I think, is one of the most important. So there's multiple phytochemicals in one compound. So I'm just going to show you. This is just a partial listing of known constituents in a typical St. Johns Wort product. And as you can see, there's a large amount of ingredients that goes into one herbal product. And if you think about things like Panax ginseng, which they add to multiple supplements, there's around 500 phytochemicals that they found in a ginseng. So, and they're putting that in everything. So just to be aware, there's a lot of stuff going on in these. Now, how do we find out about potential herb-drug interactions? There's a couple of different ways. Usually it starts with a case report, and case reports appear in the medical literature, and they really can't establish causation, but they can help kind of put together a hypothesis about possible interactions. This is sort of what happened with Ephedra, and I'll talk about that here shortly. There's also other reporting systems like adverse event reports that are submitted to the FDA's MedWatch program, and I'll talk a little bit about that. And then these last two are in vitro and in vivo studies. So in vitro studies look at the effect of phytochemicals on purified enzymes and transporters in the body. Now, almost all in vitro studies will show some degree of significance. If you expose these enzymes and transporters to a high enough concentration of phytochemical, you're going to get some type of response, and that pretty much goes for everything. However, rarely does this translate to in vivo conditions, which means in the body. So really, in the scientific community, most of the time, in vivo studies are most important to us because that actually shows us what's happening in the body. Okay, so FDA reporting is sort of not great for some of these supplements too. Supplement manufacturers rarely report serious adverse drug events to the FDA, and that's despite federal requirements. They are told to, but they rarely do, unfortunately. Between 1990 and 1994, less than 10 of more than 2,500 reports were from herbal product manufacturers. And that's kind of what this graph is showing. So you can see the green bars here is with Ephedra, and the manufacturers had a lot of customer complaints, but less than 1% of those complaints were actually submitted to the FDA. So not great reporting. Okay, so now I'm going to switch gears and talk about mechanisms for drug-herb interactions. And the first is what we call pharmacodynamic interactions. Now these are botanicals that have pharmacological properties that are similar or opposite to conventional medications. And I'm going to talk about 3 examples of this type. The first one is Ephedra. Now, Ephedra, I want to talk about the use between China and the United States because it's very, very different. So in China, they've been using Ephedra for over 5,000 years, so they know about Ephedra. It works well for them. They usually use it for treatment of asthma and nasal congestion, and they usually use it for 7 to 10 days. Rarely is it combined with anything else, especially stimulants like caffeine, and it's usually administered as a tea or a decoction, and it's not indicated as a diet aid in China. Now, let's contrast this to the United States, where we used it heavily between 1994 and 2004. It was marketed as a diet aid or an energy booster or a performance enhancer, and it was indicated for chronic use, so there was no stop date. And it was usually combined with other stimulants like caffeine, almost always. And it was also comes in the form of a concentrated extract. And that's a lot different than making a tea. So a concentrated extract is how when you take like a hot aqueous solution or a hot organic solution and you concentrate the phytochemicals that are found in a plant and you make it into a little capsule or pill, and it's extremely more powerful than if you were to say, eat the plant or make a tea out of it. Okay. So a little bit about Ephedra. Between 1995 and 2005, numerous case reports started coming in. And remember, we talked about how case reports are kind of the first alert that we see when we start seeing problems. And there was just a huge amount of these reports coming into the medical literature describing ischemic stroke and heart attacks after using this product. There was even a little seizure activity and unresponsiveness. after consuming the product hydroxycut. Maybe you remember hearing that name. Ephedra is a natural source of ephedrine-type alkaloids. It's often formulated with multiple botanicals. So remember, I showed the example of St. Johns Wort and how many botanicals are found in there. And a lot of those interactions we really haven't investigated thoroughly. So a lot of times they were formulated with guarana, green tea, kola nut, or yerba mate, all of which have a lot of caffeine. So these products that are containing ephedra and caffeine as a combination, they really potentiate each other's cardiovascular and central nervous system effects. So it can kind of cause like this sympathomimetic storm is what we call, because it's adding to the effect of one another. And ephedrine and caffeine are one of the few, this combination, one of the few natural products out there that actually decrease the blood flow to the brain. So that probably led to a lot of the case reports for ischemic stroke. And they also marketed it as a weight loss thing to take right before you're going to vigorously exercise. So this really causes a lot of sympathomimetic problems in people. So after several high-profile deaths, including some athletes in the United States, ephedra sales really started to plummet. So manufacturers said, what can we do? How about we just take the ephedra out and just, market it as ephedra-free? Well, unfortunately, we're starting to see case reports coming in with these ephedra-free products as well. So what that kind of tells us is that maybe ephedra wasn't the entire picture, the entire problem. Maybe it's the vigorous exercise with a huge amount of caffeine and all of these multiple chemicals combined into one product. So I thought that was kind of interesting. So licorice root extract is also found in a lot of weight loss supplements. It can inhibit the conversion of cortisol to cortisone, which results in sodium retention and potassium depletion. And that can cause us a lot of cardiovascular effects, as well as others. Chronic use leads to hypertension and increased risk of arrhythmias. And if you think about it, people who take weight loss supplements may be overweight, perhaps, and they may have underlying cardiovascular problems, and they may be on blood pressure medications. And if you're taking these products that are increasing your blood pressure and increasing blood pressure, it's going to, and you're taking it with a lot of caffeine on top of that, it's really going to make all of those cardiovascular medications you're taking to lower your blood pressure, it's not going to make them ineffective. So working against one another. Okay, so we talked a little bit about pharmacodynamic interactions. Now I'm going to talk a little bit about pharmacokinetic interactions. Now, these may affect drug absorption, distribution, metabolism, and excretion. And it also might affect the enzymes that our body uses to break down drugs, to use drugs. So maybe, or you may or may not have heard of what we call the CYP-P450 enzymes. These are enzymes in our body that help us break down drugs and make them absorbable. And we also have these drug transporting proteins, like the P glycoproteins, which help pump drugs into cells, and organic anion transporting polypeptides, that's hard to say, which pumps drugs out of cells. So there's drug-drug interactions that affect all of these things here. So a little bit more about those CYP enzymes I was talking about. There's actually quite a few known enzymes that metabolize these drugs, and there's a few big ones that help us metabolize the majority of our drugs. The first one being CYP3A4, which metabolize 40 to 50% of all medications that we know out there. And then followed closely by the CYP2D6 enzyme. And I'll get to why those are important. So let's see if I can orient you a little bit to this graph. You'll see on the y-axis, this is the plasma concentration after you take a medication. So if you were to take a pill and we were to measure your blood to see how much is in your blood, in your system over time, this is how we measure the level anyway. So in the middle line here is normal metabolism. So we're not affecting any enzymes or anything. And you can see it gets right into that therapeutic window where it's not toxic and it's still working. So we like it right in the middle there. Now, if you look at the dark blue line, that's when we induce these CYP enzymes. And what that means is that we turn genes on that turn these enzymes on, and they start eating up all the drugs. And so very little of the active component will get into the system. So it really renders those drugs ineffective. And if you contrast that with this top line, that's inhibition of the CYP enzymes, which means you're kind of blocking the action of the metabolism. So it makes your blood concentrations go up really high, and you might see toxic manifestations there. So let's talk about why that's important. I got examples of both. So first is St. Johns Wort, and this is very well documented. It's all over the literature. A little history, it's used for an antidepressant. It actually works really well. It does have multiple drug interactions, and that's because it induces the CYP3A4 and the CYP2E9, 2E1, 2C9, and it also is affecting these drug efflux pumps. Now, interactions are multiple, so things like digoxin, warfarin, simvastatin, verapamil, it's really going to make those not work, basically, because it's inducing that metabolism. So a lot of case reports started popping up with all of these heart transplant, liver transplant, and kidney transplant rejections. And they figured out it was linked to St. Johns Wort. So this is, let me back up a little bit. So this is for people who were taking a specific drug for transplant rejection called cyclosporine. So people who were taking these cyclosporine for these transplant rejections started taking St. Johns Wort, and they noticed that they started losing their transplant, which was terrible. And I have an example here. So this is a 28-year-old white female. She had a kidney transplant 5 years previously, and she started taking cyclosporine because she had this kidney transplant, and they were taking her levels every month because they want her to be within that therapeutic range. When your levels are too high, you have toxic effects to the kidneys, and if they get too low, then it puts you at risk for rejecting the new organ that you got. So she was bumping along and was in perfect range, and she was taking 100 milligrams twice a day, and it was fine. Well, around December, I guess she started feeling a little depressed and started taking St. Johns Wort. And so her levels started going down, and the surgeon was scratching his head. He couldn't figure out why her levels were going so low. And finally, she revealed to the dietitian on the transplant team that she had started taking this St. Johns Wort. She said, do you think this is what's causing all the problems? So sure enough, as soon as she stopped taking that St. Johns Wort, her levels shot really high. They dropped her dose back down to what she was taking previously, but unfortunately, it was too late, and she had to go back on dialysis, and she lost her graft. So that was a really, really serious drug-herb interaction. Okay, now the opposite of St. Johns Wort is golden seal. So golden seal is used for colds, upper respiratory tract infection, GI disorders. They also use it to mask urine drug screens. doesn't really work very well. And its mechanism for interactions is the CYP3A4 and the CYP2D6 enzyme inhibitors. And if you think back to that pie chart that I showed you, CYP3A4 and 2D6 they're responsible for about metabolism for about 70% of all the drugs that we use. So if you're taking Golden Seal and you're taking a conventional medication, it's probably going to have a major interaction. Now, I thought this was kind of cool, a little history for history buffs out there. During the Civil War, the Federal Navy blockaded some of the major ports in the South, so they were unable to get quinine, and they were using quinine in the field to help lower fever due to malaria in the Civil War. Well, when those ports started closing down, they couldn't get the import from South America that they used to get, so the Surgeon General from the Confederate Army tried to find something else to work in its place. So they tried a plethora of different herbal drugs to see, if anything worked, or anything, see if they can use that in the field. And they didn't really find a replacement, but they did find that if they took Golden Seal along with their quinine, they needed less quinine and it lasted longer. So, kind of cool. They didn't know that back then. So, let's pull out some chemistry. So, the active ingredient in Golden Seal is this little piece of the molecule that I have circled up here is a methylene dioxyphenyl group. Now, those are produced by plants as an insecticide. So, a lot of botanicals out there produce this chemical because when an insect starts chewing on them, they can't get up and run away, so they have to be creative and make weird chemicals, so it can kind of deter the insects. That being said, there's a lot of botanicals out there that produce this. One is piperine, so you might recognize piperine as black pepper. That's what our black pepper on our table is. But don't get scared, because seasoning food is different than taking that concentrated extract that I was talking about. So a couple of sprinkles of pepper on your food is not the same as taking that, concentrated extract in a capsule. And another one, you can see the very top of that molecule is that methylene dioxyphenyl group. And this is on another botanical called Schizandra. And when I started researching Schizandra, man, it's like a miracle drug. It's good for the skin, it's good for the liver, it promotes longevity, you'll live forever, your hair will be beautiful, and just whatever else. It's also found in a lot of weight loss supplements as well. Now, this graph is kind of hard to see, I apologize. But again, this is looking at drug levels when taken with Schizandra, and this happens to be tricolomus, which has kind of taken the place of cyclosporine for transplant rejection medications. Anyway, the top line is when tacrolimus was taken with Schizandra, so you can see the area under the curve is a lot higher than that bottom broken line where it's just tacrolimus alone. So this is really important for medications that you want to keep in that therapeutic window. So again, we don't want them to be toxic, and we want them to be effective. Okay, so I'm about to get excited. I want to talk about a little thing called dosage performance. This might not make anybody else excited, but if you're a pharmacist, we love this stuff. This looks at how well something will go into solution. So some botanical supplements don't really pose any kind of serious drug interactions because they don't get absorbed, they don't go into solution. So things that affect this dosage performance that I'm talking about are things like molecular weight, aqueous solubility, lipophilicity, permeability of the capsule or tab that it's in, and will the active components contained in each go into solution. Because if they don't go into solution, they can't be absorbed. So a lot of them, why even take them? Because we're not even getting them in our system. And we know, unfortunately, we don't know a lot about botanicals and how well or how good their dissolution profiles are, just because there's just not enough funding to do these tests to see how well they will go into solution. Now, this is a lot different than conventional medications because the FDA says they have to be able to dissolve, they have to be able to go into solution so that they can get absorbed and have an effect. So a lot different. But that being said, I do want to talk a little bit about some various herbal supplements out there that just case reports have come out. So not very strong evidence on efficacy and really even some of the safety, but there are just reports that surface in the medical literature about some of these. So I'll start with Ginkgo biloba. Again, it sounds like a miracle drug to me because they use it for cognition, memory, cerebral vascular disease, peripheral vascular disease, impotence, tinnitus, which is ringing in the ears, sexual dysfunction, mood, all kinds of stuff. I think I want some now. So, efficacy, though, is really mixed. It's ineffective for dementia, Alzheimer's, and preventing cognitive decline. It doesn't work for lowering blood pressure or reducing hypertension. But there is a little bit of data that supports that it might help with intermittent claudication and maybe a little bit of the ringing of the ear. However, it's small and not real strong data supporting it. Side effects and cautions for ginkgo could be headache, nausea, it might upset the stomach, might cause diarrhea or cause dizziness. And allergic reactions are pretty common throughout the botanical supplement world. And some data suggests that ginkgo might increase bleeding risks. So especially anybody who might be taking a blood thinner, and that includes like aspirin, especially warfarin. Warfarin interacts with everything, it seems like. Excuse me, and then anybody who might be having a surgery or any kind of dental procedure might be aware. Okay, now I'll talk a little bit about ginseng. So this was new to me. I learned there's three or four different types of ginseng. There's an Asian ginseng, American ginseng, and Japanese ginseng. And then there's another Siberian ginseng, but that's a root of an unrelated species. So sometimes I read that manufacturers will sometimes take like a Japanese ginseng and market it as an American ginseng because apparently the American ginseng is a better product or quality. I don't know how true that is, but again, misidentification of plants. And then there's a red versus white for preparation, and I didn't really understand how that worked, but there's different ways that they prepare the ginseng. So it's used to promote vigor, potency, well-being, longevity. In China, they use it for chest pain and heart attack and congestive heart failure. And they also use it to lower the blood sugar. Now, for efficacy, there's a lot of mixed results. So it's possible that it has some effects on the immune function and lowering blood glucose. But again, studies are very small, and the data is not that strong to support it. And interestingly enough, it can have hypotensive and hypertensive effects. So it can lower blood pressure and also cause an increase in blood pressure too, depending on how you use it and the strength and quality of the product. Okay, so side effects of ginseng can be headache, insomnia, again with the GI problems, allergic reactions. And this is important because they have found that some ginseng products have germanium, which is a contaminant, and that can cause diuretic resistance and renal failure, so yikes. And there are some case reports floating around out there that it reduces the effectiveness of warfarin, but they really don't know why that's happening, but there are some case reports that that show that. Okay, garlic, my favorite. Everybody loves garlic, right? So garlic they use to improve circulation. It helps with cholesterol, decrease blood pressure, can help with the plaque buildup in the arteries, has antiplatelet effects, it can help with the immune system. So again, it does all kinds of cool stuff. But garlic is one of those things that gets me excited with the dosage performance, because the active compound that supposedly does all this wonderful miracle stuff is called allicin, and that requires an enzyme combined with another phytochemical in there. When the garlic is crushed, those two come together and that becomes active. But it's extremely heat sensitive and pH sensitive, so you can bite into a clove of garlic and chew it up, and it's active for about 2 minutes until it hits your stomach pH, and then it's not active. So I know that there are some studies out there now. The manufacturers are trying to find ways that they can produce this so it's more bioavailable or more absorbed in the system. Okay, efficacy is mixed on garlic. So studies have been done with fresh, dried powdered garlic tablets, aged garlic extract tablets, but none really showed any clinically relevant decrease in blood cholesterol, although there is a little, but it's not great. It's probably like eating Cheerios. I think it helps your cholesterol by 1 or 2%, which is not great. Some research shows that garlic may slow the development of the plaque in the arteries, but again, small studies. It might lower blood pressure just a little. And again, as I mentioned before, they are looking at how to create a product that's absorbed in the system and actually works. So it's pretty safe in most adults. The worst part is the breath and body odor, so vampires won't bother you, I guess. And that's most common with raw garlic. It can thin the blood, though, a little bit like aspirin, so avoid use with warfarin or other blood thinners that you might be taking. And so it might increase your bleeding risk, so be careful. And that's about it. I just want to kind of go over some of the big points here. Again, there's large variations in manufacturing, storage, and lot-to-lot concentrations, so just know that even though the bottle says it's 200 milligrams, it probably isn't. Sometimes they're very cheaply made, and sometimes it's expired, so they have expired herbal products in there. Again, marketing regulations, we talked about that. They have very little marketing regulation. And a lot of unethical marketing techniques have led to false advertising about safety. So I challenge you all to go out and look at supplements and see what kind of claims they make, like doctor recommended, or world's most powerful, or patented, or now available without prescription, even though they were never a prescription drug to begin with, so it can be hard. Dr. Oz. Contamination with heavy metals or carcinogens or other pharmaceutical compounds, just be aware that they're not always pure. Unregulated steroids are sold to the public, including minors, which I think is really scary. In 2007, the FDA issued 9 safety alerts, warning consumers to stop using 13 different brands of marketed dietary supplements due to testing, which identified the steroids contained in a lot of them. So that's not good. And no, there's multiple mechanisms for herb-drug interactions. So we talked about pharmacodynamic, pharmacokinetic, and even if it gets into the system at all. And then I can't drill this into everybody's head enough. As healthcare providers, we need to ask our patients very specific questions. So a lot of people don't think that eating 12 cloves of garlic would be a problem, but it might be. So let's ask very specific questions, what patients take. And as consumers, let's be aware of marketing schemes and And let's not be duped by false claims and lies, unfortunately. As we saw, it's a big business, and they make a lot of money off of us, which is unfortunate. So I think that's about all. I'm open for questions, if we have any.
Thank you very much, Jenny. That was great and very informative. And maybe Lorraine Hartway and Barb Blair could collect these cards and we could answer some questions. But first off, what do you think about Red Bull and Monster drinks? Are those safe for the public?
Okay, so again, those drinks contain high amounts of caffeine, and they also have things like guarine, I think, that we talked about earlier too. They have multiple sources of caffeine, and a lot of times you're drinking them very quickly. So even if they have the same amount of caffeine as a cup of coffee that you might sip, throughout the day, you might take a gram of coffee just by sipping your coffee all day. Some of those are marketed as shots. And caffeine is very thoroughly absorbed and almost completely absorbed in the body. So if you're taking that large amount right away, very quickly, then it can cause an increased blood pressure and that sympathomimetic pharmacodynamic effect that we were talking about. So they can be dangerous too.
And there was a question from one person. Do you know anything about anything toxic in the way tea bags are made?
I don't know, actually. That's a great question, but I don't know about manufacturing processes. Great question.
And also, while they're collecting the questions, in your packet, Jenny has prepared 2 articles, one on the interactions with Coumadin, which is a great chart, and the other is among some of the drugs, the substances that she discussed tonight. So you can bedtime reading for those. Oh, and we also found a pair of glasses in the food room, so if any of you left glasses on the table when you were having dinner, please let us know. Here's a question. Can garlic be used as an anticoagulant, and if so, what dose?
Well, again, I figured one of those questions would come up, and do I recommend golden seal to be taken with your other drugs so you can take less and have it last longer? Again, the variation in the products that you can buy, like as an extract, is just, it's hugely different. So, as a healthcare provider, I couldn't risk somebody's life on that variability. When I know that we have conventional medications that are measured and exact and not contaminated, and we know the exact amount in them. So I wouldn't recommend it, no.
Is there any government agency that monitors the advertised claims of the extravagant effectiveness? Other products are reviewed for truth in advertising.
Yes, and so maybe you guys had heard in the news recently that was it the Surgeon General, I think in New York, they did a big test on a bunch of herbal supplements in New York State and asked that they remove them from the shelves. So there is some out there, but not enough. Again, with 80,000 different products out there on the market, there's just not enough manpower to constantly regulate that. And they might shut one website down and then another one pops up the next day. So unfortunately, it just happens and there's not enough regulation. But, I do want to add to that, though. How do you know if a supplement does have what it says in it? There is a regulatory body called the U.S. Pharmacopoeia, which has really high standards of testing. So I recommend, like for vitamins and other supplements that choose to go through this, what am I trying to say? It's not mandatory, it's voluntary. If they choose to have their product tested so they can get this USP seal, it is a good quality standard, but not very many people will pay or have that quality to take to the USP to get that standardization. So, but great question.
Another good question. Do you have a recommendation on where to find data on quality assurance activity and purity of products by the manufacturers?
That's
Is
it. So that USP, if you see the USP seal, that's a good note to find that it might be, or it has independent testing that that's what's actually in there. But again, it's kind of hard to find. And my sister was actually asking me about this type of vitamin. It's kind of expensive, and she found it on Amazon, and it's supposed to be this super mega awesome vitamin. And she says, you know, hey, what do you think about this? And I said, well, it's funny because it says that it's up to USP standards, but it doesn't have that USP stamp. So, gotta be careful.
So here's a very apropos question. Could you address the efficacy and of glucosamine and chondroitin sulfate?
Yes, I can. We learned about this in school. I thought it was really interesting. That's kind of what got my interest in herbal supplements sparked. There was a really good study that shows that glucosamine chondroitin works really well. But when they started to do this randomized controlled trial to see if it actually worked, they took 20 different products, and they couldn't find one had 120 milligrams, one had 1 milligram, one had 50 milligrams, and you can't compose a study when it's so variable. So they ended up having to make their own, so they knew exactly what was in it and tested it for that, and it actually does work well. But finding that one that has the active ingredient that's standardized is difficult.
So are vitamin supplements regulated like herb supplements? Or just
Vitamins are not regulated.
Not regulated.
They are not regulated. But again, that USP seal is something to look for, and I don't want to misspeak, but I think like nature-made vitamins have that USP seal. But just look on the bottle, it should have that. And I think you can go to the USP website and see what they endorse.
And a question on how safe are vitamins?
Oh, good question. I like that question because, again, as a consumer, and I'm no different than anybody, it's hard not to read something on the internet or the magazine that says, try this wonderful mega vitamin because it's going to prevent all these diseases, and it's great, and you need 1,000 times the recommended amount, and it's why do we need 100 times the recommended daily amount? So sometimes they can be toxic, and I work in a hospital, and I have seen patients that are admitted with vitamin toxicity. So my personal recommendation is to, get levels tested on some of these supplements to see if you even need them, because most of the vitamins that we need, we get from our food. And especially if we eat healthy, then you really don't need a whole lot of supplementation.
So a question on fish oil. Is it good for inflammation? We think it's good for inflammation in the heart, but is it good for inflammation like in tendonitis or knee or Achilles tendonitis?
I don't know, actually. And again, it depends on the quality of the product and if it actually gets absorbed. So that dosage performance is really important. So a lot of supplements out there don't even get into our system. So I don't know if it helps with inflammation, honestly.
And another really good question about grapefruit.
Oh.
So how long should one wait to eat or before drinking or eating grapefruit after taking a statin drug?
I don't know if...
cholesterol-lowering drug in interaction with grapefruit.
Yes, and again, grapefruit is, that kind of is what really started the FDA's interest in trying to regulate some of these supplements more, because, they found out people were taking their statins, especially, and warfarin, and they were drinking grapefruit juice, and it really had a huge interaction. And they said, what the heck? How can grapefruit be, have that much interaction? But it does. And, it's hard to say if there's like a time, because I don't think that the effects wear off necessarily. So, usually when I counsel patients on warfarin, I kind of say, just avoid the grapefruit. I'm sorry if it's your favorite drink or fruit, but it just has so many, serious interactions that I say, maybe just cut it out of the diet. Switch to orange juice.
So Dr. Mills has a question for his wife.
Well, actually, I was going to just comment on that. It was something that recently reported survey. Grapefruit certainly does have some interactions. I believe it's like golden seal, and if you have half a grapefruit once or twice a week,
Yeah.
no grapefruit juice.
Half a grapefruit once or twice a week.
Good. Thank you, Dave.
Are over-the-counter herbal cough syrups better for you than codeine cough medicines?
Better than codeine. Well, I don't know. I mean, I guess that depends if it works for you or not. I mean, you can try both and see which one works best for you, but just make sure you tell your doctor that you tried 2 or 3 different things. Codeine, I know, causes a lot of upset stomach and a lot of nausea, vomiting, so codeine's not a real popular drug to use. It does help with cough, though. It works really well, actually, as a cough suppressant, but I don't know about the herbal remedies so much for that, to compare them anyway.
Could you comment on the usage of essential oils, their safety and therapeutic value?
I think essential oils, it depends. Are you taking them orally, or are you using them as an infuser or on the skin?
Both. She commented on orally and some are transdermal. What do you think?
Yeah, orally, you might run into some interactions. Probably topically or inhaled, like in a diffusing system is probably okay. Again, I wish I can answer these questions better, but there's just not very much medical literature that supports the use of these things, and just a few case reports on some of the more common supplements are out there. So, yeah, I'm sorry I couldn't answer that better.
And a question on why some companies use specific supplements for different uses and completely different uses than we use them for. Do you have any thoughts about that?
Is that like when we compared the use of Ephedra in China versus the United States? Well, because they're making money. So you have a stimulant, and they use the use in China kind of to back the safety of the product. Well, China's been using it for 5,000 years, so it's safe, but they're using it a much different way. So really, it's a money game, unfortunately.
So the person who asked the question on the P450 induction, I think I'll let you ask that to Jenny after we finish. And are there any other immediate questions before we break up? So question over here.
Well, I'm wondering about purchasing medication from by the web, on the web, from perhaps Canada or India or wherever.
Great question.
And what's the safety?
Okay, so
I'll
the
repeat-
question
I'll
is,
repeat the question.
okay, the question is, what about conventional medications that you can buy perhaps on the internet that are from India or from Canada? And in pharmacy school, we learned that we can't always trust them because, for one, if you're buying anything from the internet, you never know exactly what you're going to get. We hope that we get something safe and effective, but it's not the same as getting something from a U.S. pharmacy. So they have different regulations than the United States, and I think the United States has a very high standard of quality and efficacy here. So I would recommend against ordering medications, especially life-saving medications, from another country. That's a really good question. So the question is, the phytochemicals contained in one, like I showed the example of St. Johns Wort, and there was 3 columns of phytochemicals that is in one product. Are those naturally occurring, or are they added? A little bit of both. But the difference between our conventional medications A lot of them were plant-based, so we got our idea from a botanical, but we were able to take that very specific active phytochemical and synthesize that and make it a single entity into a conventional medication. So that's a little bit, what's different. And the problem is that we don't know the activity of a lot of those phytochemicals. So they might be naturally occurring, but mushrooms are naturally occurring, and some of them can be really toxic. So we have to be careful. Natural does not always equal safe. Good questions.
Well, Jenny, thank you so very
Sure.
much for doing that.
Thank you for having me.
Really appreciate it.